Hi everyone! As we prepare for today's finale event, we want you to get to know the 60 MassChallenge HealthTech and FinTech startups. That's right, 60 in this year's cohort. That's a lot of startups. So we've asked them to share 1-minute lightning pitches about their companies. First up is the HealthTech cohort, followed by FinTech. If you like what you hear, get in touch, reach out. Click the Learn More button on this page to see how you can support these startups directly. Now, on to the pitches.
Hi, my name is Fedor Belomoyev and I'm a CAO of a blind company. Our goal is to expand the capabilities of blind and deaf-blind communities and eliminate barriers they face in communication, education, employment, transportation, and independent life. No matter where you have impairment or disorder, you should have same access to all service as other people. You are welcome to become shareholders, investors, partners, advisor. You will become a part something big and important. It is investment in the development of society, in society for equal opportunities. We need your support, and together we can achieve the real goals. From the moment we started participating in MassChallenge, we entered in American Assistive Technology Industry Association. And the present the product in the CSUN Activity Technologies Conference, the 80% of the visitors of our stand made pre-orders. In early May, I will be in Boston. From there, we will start entering in North American market. Thank you all and see you soon.
About 80% of healthcare data is textual, making it impossible to automate time-consuming tasks. At Agamon, we specialize in NLP, converting those unstructured clinical data into structured data in order to streamline administrative processes, improve quality of care, and increase revenues. We started with radiology, and we are open to expand to other areas, where our platform can extract useful information and solve your challenges. Thank you.
At Augment Therapy, we're using technology to motivate kids to do therapeutic exercise. Kids feel like they're playing a video game, but our evidence-based exercises and objective data collection are a therapist's best friend. Best of all, our augmented reality solution doesn't use any wearables and can be used in the clinic, via telehealth, or for remote patient monitoring for ages 3 to 103. Our MassChallenge partner, OSF Healthcare, is working with us to build pilots in their inpatient and outpatient settings. These pilots will provide vital data on how our gamified telehealth-enabled platform can improve patient engagement across all settings, improve access to care, and a hospital or payer's bottom line. At Augment Therapy, we take the pain out of therapy and prove that patient engagement matters.
We know wellness apps have low engagement, but did you know that wellness apps have one of the lowest long-term engagement rates in the entire mobile app category? That's why at Better You, we wanted to make keeping up with your health as easy as having your phone on you. Because my phone can automatically give me credit for visiting a gym or a park, or even for getting off Netflix at a reasonable hour so I could get some sleep. We leverage this insight to make a digital companion that helps people redirect and find more time in the day for their health goals. Today, over 65 enterprises use our product. And the best part is 30% of people who touch our app stick with it in the long term, finding new ways to be a better you.
For the over 50 million family caregivers in the United States, handling life's daily tasks like household chores and medication management is just the tip of the iceberg. Unpaid caregivers have no choice but to learn the nuances of their loved one's medical condition, insurance coverage, estate and financial planning, and all of the lifestyle changes surrounding care.
Rather than expecting caregivers to learn the depth of dozens of fields, we believe it should be easy to tap into the knowledge of the right professional at the right time.
CareGather is the online marketplace for the expert services that family caregivers need to support their loved one. We aggregate and thoroughly vet specialists to serve caregivers across their spectrum of needs, such as insurance navigators, home safety experts, elder care attorneys, and behavioral health counselors. We make it easy for family caregivers to find, schedule, and receive the services they need to spend less time navigating the complexities of care and feel confident they're doing what's best for their loved one.
Digby Health is a team of doctors, microbiologists, software engineers, bioinformaticians, and business builders that have commercialized an AI-driven, value-based precision digital therapeutics platform for inflammatory digestive, skin, and insulin-related disorders. The risk of these illnesses varies significantly across ethnicity and gender because they are rooted in the interactions between a person's gut microbiome, genetics, and their lifestyle risk factors. We are the first company that has successfully integrated, using AI, clinical blood-based risk markers with gut microbiome, genetic, and lifestyle-based risk signals to provide a personalized care that is being offered as a fully covered benefit by insurance companies and self-insured employers, while delivering superior health outcome, unprecedented employee engagement, and financial savings to payers and employers.
Hi, I'm Rashna Dhamija, CEO of Egenta. Egenta is a remote monitoring platform that's using AI and automation technology. We're working with some of the largest healthcare providers across the US, like Kaiser Permanente. And we're really excited to be working with Harvard Pilgrim Healthcare as part of MassChallenge. We've had a lot of exciting news lately. We just signed an LOI with a large pharma company. And we also just secured a contract to develop remote care for astronauts in space, working with the Baylor College of Medicine and with NASA. So please reach out if you're interested in remote monitoring and remote care. We'd love to discuss the opportunity to work with you. Thank you.
Hello, everybody. My name is Luca Schnettler, and I am the CEO and founder of Healthy Health. Healthy Health, in one sentence, is helping life and health insurers to move underwriting to the 21st century, because let's be honest, it's kind of been stuck 200-300 years ago for a while now. Healthy Health's product suites enables any prospective insurance customer signing up with one of our clients to share their digital data to get a price instead of filling out long-form questionnaires or going to the doctor for a medical exam. That procedure can both work through an agent channel as well as an online channel. Healthy Health has grown significantly over the last 3 years in its operation. We have now offices in London and Hong Kong, and we work with large listed multinational insurance and reinsurance companies in the US, in Europe, and in Asia. And to put one number out there, in the next financial year, we have already contracted to underwrite around 1 million policies on behalf of our large clients.
Hi, I'm Scott Cravens, CEO of Gelada. We sound like a hipster coffee drink, but we are actually an interoperability platform that is making communities safer and healthier by multiplying the impact of existing local resources. For over 20 years, Dr. Rick Penskowski watched how a disconnected system resulted in repeated low acuity patients being brought into his Colorado Springs emergency department with needs that could not adequately be addressed there. So he put his computer science master's degree to work, and in 2010, he developed the touch phrase interface that he later patented. North of the Springs in Denver in 2013, a talented young systems architect left iTriage, one of the first successful health IT exits, and joined MapQuest as its principal software engineer. However, in his first week on the job, he lost his sister to opioid addiction after she struggled for years. He realized at this point that her untimely death could have been prevented through coordination and collaboration of local resources. Later that year, Michael and Rick were introduced, and Michael developed a community interoperability platform utilizing Rick's touch-phrase interface. Around the same time, a friend of Rick's also passed away who was fond of saying about wayward kids, "You just have to love on them." From that phrase came the name for the new platform, Gelada, an acronym for Just Love on Them Always.
Alzheimer's is the most expensive disease in the US, costing $305 billion each year, plus an additional $244 billion in value of unpaid family care, and the number of seniors with the disease is exploding. Yet, tens of billions can be saved by supporting and training family caregivers to help their loved ones live at home longer and reduce avoidable hospitalizations. Kinto is a tech-enabled care coaching service delivered via mobile app and developed in partnership with the Alzheimer's Association, who are supplying us with expert coaches. We launched our MVP in January to an overwhelmingly positive response from our families who tell us that Kinto has changed their lives and they would recommend Kinto to every caregiver they knew. With the help of our MassChallenge champions, we are deploying an employee benefit solution for large employers and a cost reduction program for Medicare and Medicaid plans. Learn more at kinto.care.
Hello, I'm David Franklin, and good day, MassChallenge. What an amazing time we've had these past few months with our champion and supporting cast. At NoRx, we've had concentrated our time on identifying our buyer, product market fit, and messaging around product deliverable and what we describe as the 4 pillars of therapeutic equity. Here, the NoRx machine learning platform will drive engagement of physicians and source patients for clinical research opportunities that contribute to better health outcomes for all and reduce operational time in clinical trial recruitment and selection. During our time with MassChallenge, we've completed a patient pilot in Cincinnati and reached revenue by supporting our first client where we worked with them on their COVID-19 vaccine trial. We've taken the opportunity to participate with all partners and programs MassChallenge has presented to us, and we are better for it. Thank you many times over. Thank you.
Hi, I'm Swati, founder and CEO of Lightsbright, and we build games to help people manage chronic health conditions. Clinicians and players rely on our data insights. We have created the first ever clinically validated mental health video game with validated reimbursement pathways, Cinesprite. We've won over 25 Global Health Innovation Awards, including the first video game to win a US Surgeon General Award. With Cinesprite, we've taken a fresh approach to how mental health is treated, offering a family-friendly experience that appeals to all ages. Our retention rates are well above the industry average, and we've been able to treat some of the most difficult to reach populations. Through the years, we've tracked over 6,000 users, and in the last 90 days, we have signed up several employers, validating our go-to-market strategy. With the backing from strategic investors such as Bayer Pharmaceuticals and our MassChallenge champion AARP, we aim to keep building on this success. If you are an employer, payer, provider, or an investor looking to reimagine mental health, join us on our journey. Thank you.
Hi, my name is Michelle, and my job is to save lives with LifeGen. In less than 5 years, the spend on innovative cell and gene therapies will exceed $50 billion. At LifeGen, we believe that every patient has the right to access innovative therapies. And with our LifeGen software platform, we help manufacturers and health insurances to provide these new therapies to patients. But how are we doing this? Our technology enables health insurances and plans to only pay for the therapies if they actually cure the patients. And if not, health insurances will get all their money back. With over 15 clients, LifeGen is changing the way expensive drugs and therapies are paid for and saving lives of patients in the US and around the world.
I'm Anna Barnacka. I'm the CEO and founder of MindMikes. I spent a decade monitoring black holes, but it shocked me that when I was experiencing stress, there was no way to easily monitor my health with medical grade accuracy. I use my skills to enable precision monitoring of our vital signs for two things we all use: earbuds and smartphones. Today, our mission is to provide actionable precision health monitoring for all. Our clinical trials show that our novel earbuds could be the next generation of medical-grade wearable devices. We are making tremendous progress in getting ready with our platform for our first quantified self-users by the end of this year. We invite you to join us in making this actionable precision health monitoring accessible to everyone.
The need for remote care in the home has never been greater, and technology should be a conduit, not a barrier. We are OhmCare, a digital health company pioneering a product platform that enables remote care in the home and redefines medication adherence as right med, right time, right person. Our first product, the OhmCare Home Health Hub, serves as a portal for care, connecting the patient directly to their providers. Using our simple, interactive technology platform, Senior Care, Medicare Advantage, and other providers can extend their reach and bring existing infrastructure and services into the home to improve health, reduce cost, increase member engagement, and elevate the patient experience. OhmCare is a MassChallenge finalist selected by AARP as our champion. We are currently in pilot and experiencing excellent results. We welcome conversations about enabling your care from anywhere. Thank you.
Hi, my name is Alex Costello. I'm the founder and CEO of QuickerCare. We're the digital healthcare company that uses patient symptoms and artificial intelligence to route sick patients to the right type of immediate care facility. That means we work with emergency rooms, urgent care facilities, and telehealth providers to route patients to, have those patients fill out all their patient forms, and even integrate all that data right into their EHR so everybody has a great experience. We have a little over 200 customers who currently use us across the United States. And just starting right before this program, we actually launched our COVID-19 vaccine management system that is actually deployed in 7 different states and 2 different countries at this time. And we've actually booked over 6 million different COVID vaccines across the US. So look forward to chatting with anybody after this. Thank you.
Hi, John Gobron with SafeDose here. You know, it's been a real honor to be part of the MassChallenge cohort this year. Yeah, that should be 5. Thanks. Where was I? Oh, the collaboration, the experience, everything's been so world class. No, I'd go with blue. Thanks. You know, I'm just trying to record a video here, but imagine if I'd been a nurse trying to administer a high alert medication to a child. Really, you don't have to imagine. Nurses get interrupted all the time when they're trying to give medication. It's a real problem. Studies show that more than 30% of pediatric medication doses are incorrect at US hospitals, whether it's a critical access hospital in the mountains or the most advanced pediatric center in the world, like our champion Boston Children's. Together, we're trying to make sure that all pediatric medication doses are double checked. Thank you.
Hey, this is Suzanne Mitchell, and I'm founder of See Yourself Health. Living with a chronic disease is demanding, and the burden on patients is significant. The skills and knowledge that people need to live well with a chronic disease is vast, and people struggle with gaps in health literacy that lead to poor health outcomes, high cost, and most importantly, despair. And that's where See Yourself Health comes in. We're filling those gaps in health literacy by making chronic disease education and self-care actionable. Our award-winning team has created a virtual reality experience that offers group visits and simulation experiences to build confidence, know-how, and most importantly, to foster friendships. Our real-world research with more than 400 diabetes patients proves that our approach works. We got high engagement, lower costs, and better disease outcomes. More importantly, our cloud gaming solution means we can offer our program to anybody, anywhere that needs it. Come check us out at seeyourselfhealth.com.
Hi, everybody. My name is Nick. I'm the founder and CEO of Semantic Health. We're a machine learning company with a vision of taking all of the unstructured, fragmented data in healthcare and making it actionable. And what this means for us right now is we're helping hospitals automate and streamline extremely manual and error-prone processes like medical coding, auditing, data quality improvement. These are the core processes that are bottlenecks right now to this information being able to be used across the hospital in an efficient way. And so we've worked with many customers over the last year and have seen amazing results around accuracy, productivity, efficiency gains, and most importantly, data quality. And so we're excited to continue building this actionable data layer with our customers and with more hospitals across the country. Please reach out if you're interested or want to learn more about what we're doing and what we're up to. Thank you.
If I asked you which are the costliest health conditions for private insurers, you'd probably say diabetes, obesity, maybe cardiovascular disease. But the answer is childbirth. At Soci, we believe we can improve maternal health outcomes and improve patient satisfaction while decreasing costs. In fact, just a 1% reduction in C-section rates is worth billions in savings to payers. Soci is digital health and wellness for new and expecting parents. With online classes, self-serve problem-solving tools, and escalation experts when needed, we'll support people from trying to conceive through about 3 years postpartum. Our go-to-market is childbirth prep, and our live product has rave reviews and stellar user engagement. I have 20 years of experience building engaging products at companies including Pinterest, Trulia, and Virta Health, and I'm also a mom of 3. If you're a payer, a provider, or an investor, we'd love to chat. Visit soci.com/about to learn more.
Hi there. My name is Nick Nomonico, and I am the CEO and co-founder of Stratos Labs. As an asthma patient, I know how hard it can be to recognize my symptoms like wheezing or coughing or shortness of breath until it's too late. And that's why we created a non-invasive smart sensor-enabled platform called RESP that has been clinically validated with hundreds of patients to accurately measure wheezing and coughing, share that information back to care teams remotely in a hands-free way. Work with us today to make every breath count.
At TELUS, we've built a device for elder care that is non-contact and smart. And we do so without cameras, which invade privacy, and wearables, which are uncomfortable and require charging. Here's our device. All you need to do is plug it in, and we'll give you insights and alerts that matter, like whether your loved one returned safely to their room and bed at night, and whether their sleep pattern and vital signs have changed recently. We've piloted and sold our devices to elder care facilities in Japan, where we've been perfecting our device. We now cover several floors of facilities and enable caregivers to instantly check on the status of their residents. With our MassChallenge partner, we are now planning our product launch in the United States by conducting focus groups and interviews with promising reception. We're looking forward to making our product accessible to anyone caring for their loved ones.
Hello, my name is Maria Picconi, and I'm the co-founder and CEO of Trend Community. Here at Trend, we believe that those living with rare and chronic disease can shed light into aspects of their health conditions that even our most qualified doctors and scientists couldn't possibly know. Our ethical approach has allowed us to access and analyze conversations taking place within disease-specific closed social networks while protecting community member privacy. Using social listening and AI, our technology generates real-world insights into patient experience. During the MassChallenge HealthTech program, we matched with Takeda Pharmaceuticals, and together we've been exploring the potential for Trend Insights to accelerate the pace of medical product development for rare disease. Our approach enables access to 50% more disease communities and facilitates patient engagement during early drug discovery. We're looking for partners to join us on our journey to revolutionize the world's understanding of diseases. Thank you.
Hi, I'm Eddie, CEO of Uplift. We help people overcome depression and anxiety with our effective digital program. You can think of it like Duolingo, but instead of learning a foreign language, you're learning skills typically taught in traditional psychotherapy. Our program is centered around 11 45-minute sessions combined with easy-to-use daily tools. In the sessions, users are interacting with the program by selecting different responses or answering various questions, and then the program adapts itself to the responses, kind of like a choose-your-own-adventure storybook. We ran a pilot study showing that Uplift reduces depression symptoms by 52% and anxiety symptoms by 38%. Our mission is to break down barriers to care and spread happiness at scale. You can find us working hard to do this at uplift.app or by searching the word Uplift on the App Store. Thanks.
Hi, my name is Keith Kirkland, and I'm a co-founder at WhereWorks. We build products and experiences that communicate information through touch. Now, this is called haptics. Haptic means of or relating to the sense of touch, and we're using the skin as a communication channel to deliver information in a more intuitive way. Our first product, Wayband, is a wristband that guides a person to an end destination using vibrating cues without the need for any visuals or audio. And back in 2017, it helped the first person who was blind run in the New York City Marathon without sighted assistance. Since we've started at MassChallenge, we've partnered with the Massachusetts Commission for the Blind and worked directly with their teams to build our first large-scale pilot program. We've also secured our manufacturing partners and are currently in a top 10 finalist for the Make It Awards, sponsored by Squarespace and the New York Knicks. Thank you so much. Cheers.
My name is Layo George, founder of WellOmi. WellOmi is proud to be part of the cohort for MassChallenge this year. Because of our growth, we are also a proud sponsor of the National Black Maternal Health Week. WellOmi is well on its way to become the #1 app and community used by women of color, for women of color, to navigate the healthcare system to get better outcome. Because of a lot of the advice and feedback that we've gotten both from our customers and our advisors, we are launching our new app in the end of the summer 2001. Join us because the future of healthcare is patient-driven. Thank you.
Falling down, it's the #1 reason for trauma death and trauma injury. There's 49 million seniors in America, and 14 million of them will fall down this year. And that's going to result in $67 billion in medical costs this year. And the cost per member per month ranges from $20 to $114. Now, falling is a complex problem, and you can't just use a widget to fix it. Zebrio leans into the messiness of the problem and provides the only measurement-based fall prevention solution for payers and providers. Our solution centers around the Zebrio Smart Scale that measures weight, balance, and can predict if you'll fall down in the next 12 months. Our software then guides clinicians and patients to improve with personalized care. If you're a provider, the solution's reimbursable. If you're a payer, a 54% reduction in falls is associated with Zebrio use. And all the while, the Smart Scale gives you a real-time outcome measure for treatment efficacy. I'm Catherine Forth, CEO of Zebrio. Reach out if you'd like to reduce falls.
Now that is what I call a cohort. Now from health to wealth, here are the leading startups in this year's MassChallenge FinTech cohort. Enjoy.
Hi, my name is Riaz Nakuda, and I'm the VP of Strategic Partnerships at Action.
So Axiom accelerates AI workflows for financial services organizations with a no-code development platform. We are headquartered out of New York and have global customers across asset management, wealth management, banking, and insurance. Some popular AI solutions being built by our customers on the platform include the detection of ESG issues from natural language, forecasting early warning signs of counterparty and credit risk, and building out thematic and sentiment data for investment management. Using Axiom, our customers find significant cost savings and an increase in efficiency when building and deploying production-level AI solutions. This is enabled through three key aspects. One is our no-code UI to build AI solutions. We have over 400 production-ready use cases, and we have industry-leading pre-trained financial models. Through MassChallenge, we are very grateful to have been connected to a wonderful corporate partner, Putnam Investments. Their team has been extremely collaborative, open, and honest with their feedback, allowing us to better evolve our offering and helping them to accelerate their AI development for their investment teams. If you're exploring how AI can transform areas of your business, please reach out and we'd love to discuss how we can partner, support, and accelerate your initiatives. Thank you.
Hi, everyone. I'm Kamran, co-founder of Ant Financial. We've invented a new way to transform student debt into retirement assets. We can simultaneously lower student debt payments by hundreds of dollars per month, and we can automatically build millions of dollars in assets for retirement. For employers, we're automating a new path to affluence for young professionals, and for benefit providers, we provide a strong upsell opportunity for other financial products. This is because we put thousands of dollars back in the pockets of our customers every year. We'd like to thank our partners at AARP for their amazing work. Our product and messaging is really advanced because of it. We've recently closed a round of venture funding, and we've landed bank partnerships that will help us scale our distribution. If you have student debt or know somebody who does, you can visit us at mytrustfund.com.
Beacon provides decision analytics, helping landlords and lenders optimize their real estate. Since starting at MassChallenge FinTech, we have doubled our activated portfolio of rental homes across the United States. We've had fantastic discovery conversations with our MassChallenge partners and are actively working towards a pilot. We've grown our team to 9 people and added 3 great advisors as well. But most importantly, as the world begins to emerge from COVID, we believe data will be the vital layer to build homes, build communities, and build efficient markets. We're keen to talk to investors and partners as we work towards our goals and further our mission. Thank you.
Hi, my name is Matt Moody, and I'm the CEO and founder at Bellwether. So companies spend fortunes acquiring customers, but once they have them, they really don't do a good job of maximizing each customer's lifetime value, resulting in revenue left on the table. At Bellwether, we help companies grow the lifetime value of every customer. We do this with our machine learning platform that identifies patterns in customer behavior, which can indicate churn, as well as opportunities for cross-selling and upselling. Then, once a behavior is identified, our tools recommend the next best action based on which is most likely to result in converting the sale. Over the last 30 days, our customers generated an additional $2 million in revenue from their existing customers. So I appreciate the opportunity and look forward to connect. Thank you.
Hi there. Bodeswell has built the most comprehensive self-service financial planning platform in the world. We have partnered with a leading financial services company to launch a white label version of Bodeswell in Q1. But we want to extend the benefits of planning to the 86 million US households who don't already have a financial advisor. So if you want to build a more holistic relationship with valuable underserved customer segments, please come visit me, Matthew Bellows, and let's talk about how Bodeswell could help you achieve your 2021 goals.
My name is Steve Ely. I'm the CEO of eCredible. We help consumers and small business owners build better credit scores so they can access more affordable financial services from mainstream providers. For consumers, this means access to better credit cards, better financial terms, being able to rent an apartment, better insurance rates, even applying for a good job in some cases. For small business owners, it's helping the entrepreneur gain access to capital that they need to build their business and to grow their business. It also means being able to hire more people and purchase more inventory to grow their business. We are particularly focused on people who have had real challenges accessing mainstream financial services. This tends to be young people, immigrants, underbanked, underserved, minorities, low to moderate income consumers, people that just generally struggle to get a good deal. We know that if we can help them build better credit scores, they can build better financial profiles, which leads to a stronger financial life. That's a better life for them and their family.
Older adults want the choice of long and healthy lives in their own homes. With smaller families and fewer medical staff to support the growing number of older adults, innovative remote monitoring is needed to assess current status in the home, the need for services, and to provide information to care circles of family members, doctors, and financial planners. EmpowerU is redefining remote monitoring to include automated behavioral analysis of essential daily living patterns, like a heartbeat of the home, relevant to both physiological and mental health conditions, and to providing context to medical device readings. Most remote monitoring is smartphone-based, but these systems leave out people with physical, cognitive, technical, and language barriers, who are often the highest risk patients. Our smart home system is effortless for everyone. EmpowerU was recognized by AARP in February 2021 as a finalist in their challenge to find safe and effective solutions for aging in place.
We created Farther to bring the wealth management experience available to people who have already made it to those who are on their way up. By building a modern infrastructure to eliminate archaic processes and delivering differentiated client-facing features like cash management, custom portfolio construction, role-based access, we can deliver a family office experience at a fraction of the cost for both Farther advisors and partner institutions. That only becomes more compelling as we layer on products from banking and insurance partners. I'll look forward to exploring how we can go farther together.
Hi there, my name is Ali Dalla, CEO and co-founder here at Fineo. If COVID has taught us anything, it's that we need to be prepared for life's most unexpected moments. But unlike products that are simple to understand, such as home, travel, and pet insurance, products such as life, critical illness, and disability insurance are much more complex and nuanced in nature. In fact, 90% of these products are still sold through agents. However, competition is creeping in quickly. Direct-to-customer channels are starting to encroach on broker business, while brokers remain tangled in a fragmented and disconnected supply chain. Fineo is here to change that, and we've developed the digital ecosystem to help distribute and power life and complex insurance for a new era. On the one side, Fineo provides brokers and their customers with a toolkit to go from prospect to policy, while Fineo also offers carriers a no-code toolkit to power and supercharge digital distribution. Fineo is excited to be launching in the US after being in business in Toronto, Canada for over 5 years, and can't wait to meet you after MassChallenge. Thanks again, and take care.
Hi everyone, Pedro here from Flourish. Flourish is an engagement and financial wellness platform for financial institutions. We help banks drive customer acquisition and retention with populations that they have historically had a hard time engaging with. Growing up as an immigrant with my mother cleaning houses, making ends meet was tough. I had a successful career in banking, and it only reinforced that the products there were not designed for everyday Americans. And since then, Jessica, my co-founder, and I have been on a mission to empowering people to build positive money habits. And we're already doing so for banks in the United States, Brazil, and Bolivia. Our technology impacts 2 key metrics for the bank. We more than double user retention and drive deposit growth. In collaboration with top behavioral scientists, we are shifting the way people transact, build the habit of saving money, and transact better, using a nudge system and a gamification platform that easily integrates into the bank's own app and core legacy system. We believe that building positive money habits is more than its statistics. It is about enabling people to achieve their true dreams. If you believe that, I would love to talk to you and work together.
What's up, world? It's your boy Craig J. Lewis. I'm the founder and CEO of a company called Gig Wage. What we do simply is help businesses and platforms pay, manage, and support all types of independent contractors, gig workers, freelancers, contingent workers, creatives. It doesn't matter. If they don't get taxes pulled out of their payment, we can help you pay them better, faster, and in a modern way. And that kind of payroll methodology is really our wedge into building the bank of the gig economy. So we think if we do this right, we can finance and fund the entire future of work. Ultimately, we'll have a suite of lending products that we can provide to the gig economy that don't exist today. And by helping businesses pay people, that's really our wedge into the market. We're a Series A company. We're super excited about economic empowerment and helping not only the companies, but also the workers have that financial social safety net that they need. Check us out, gigwage.com.
Hi, I'm Tanya Van Court. I'm the CEO and founder of GoalSetter. GoalSetter is a next generation banking and financial education app created especially for the next generation. GoalSetter is the only app in the market that covers every kid in your family, from cradle to graduation, and even parents too. GoalSetter also is the only app that provides those kids with fun financial literacy quizzes rooted in memes and GIFs from hip-hop artists, social media influencers, and pop culture that they already love and are learning about financial education through that lens. Finally, GoalSetter is white labeling banks and financial institutions near you because we believe that in partnership, we can create the next generation of savers and investors together.
I'm Dan Huss, co-founder and CEO of Gravity AI, and I've lived through why companies are failing at AI. The choice is to build internally and waste resources reinventing solved problems like I had to, or to try to leverage some of the thousands of high-quality third-party solutions, but get stuck in endless security and procurement processes. So we set out to eliminate that trade-off by making out-of-the-box AI secure and compliance-ready. To tackle that, we built a marketplace for these models that makes solutions like audience segmentation, NLP, and document digitization significantly more available to the companies that desperately need them, all through a single procurement process. In addition to enterprise pilots with one of the largest healthcare companies in the world and a prominent community bank that represent a $500,000 annual recurring revenue opportunity for us, our lead funnel has ballooned to over $1 million in just the last quarter alone. History shows us this trend towards more accessible tech is inevitable, so come be a part of that history with us.
Hi, my name is Matt Kilmartin, founder and CEO of Habu. Habu is a next-generation data and analytics software company for distributed data. We help our clients connect their data assets with partner data assets in a secure, privacy-safe manner. By doing so, you're able to learn so much more about your customers and improve the effectiveness of your marketing. Early customers have seen savings of millions of dollars by leveraging the Habu platform.
HomeZada is an amazing personal finance platform that empowers consumers to manage, maintain, protect, and improve their largest financial asset, their home. We've proven product market fit and the unit economics of a freemium subscription model with tens of thousands of consumers that represent every generation of homeowner. HomeZada is also a customer engagement platform for financial services and real estate companies who need to build a digital relationship with their existing homeowner clients for repeat and renewal business. HomeZada has secured deals with a large national insurance company, pilots with National Bank's mortgage division, and the largest residential real estate brokerage in the United States with access to millions of homeowners. With customers already in multiple international countries, HomeZada is a multi-billion-dollar global market opportunity. We have 3 experienced co-founders who founded an enterprise software company that turned it into a global business that resulted in a successful sale to a public company. So if you're a homeowner, a financial services company, or an investor, join us in making HomeZada a billion-dollar company.
Hi, I'm Charles Polikoff, and I'm the CEO of Noma. You know, 90% of the world's data has been created in just the last 2 years. Yet the tools that we use to evaluate, discover, and use that data simply not caught up. That's why Noma was born. Noma was created to make data accessible and useful for both the technical and non-technical user alike. With investors like Eldridge and Snowflake, we are laser focused on making that modern day data experience a reality. With connectivity to over 57,000 data sets, dashboarding and visualization tools, patents in NLP and search, as well as full integration into the workflow and productivity suite, we are ushering a new era of contextualized insights for the end user. Please visit us at www.noma.com or email me at charles@noma.com to learn more.
Personal data represents an individual's life. When this data is mishandled or stolen, it can significantly impact them. Almost daily, we hear about data breaches at some of the world's largest organizations. It has become obvious that today's encryption standards are not enough. At Manitou, we have built a highly secure data vault to protect the most sensitive information a company holds. Our technology protects private data, allowing organizations to safely interact with it and eliminate it from source systems where it is prone to leakage. Once in Manitou, data is managed in an attested network of security kernel enclaves and never touched by humans. Every endpoint is strongly identified, authenticated, and classified. Our in-model encryption provides natural de-identification and severability. It is now an imperative for organizations to protect personal private data. The emergence of consumer data protection laws globally is making this investment unavoidable. Manitou is protecting 10 million individual identities and onboarding over 100 million with contracted clients. With Manitou, your data will be protected.
Hi, I'm Steve Dow, co-founder and CEO of Monit. As a Boston-based startup, we are thrilled to be part of MassChallenge and have accomplished a lot over the last few months. At Monit, we have two goals. First, to help banks reinvent the banking experience for their business and commercial customers, and in turn, help those business owners make better financial decisions so they can be confident about their financial future and spend more time on their true passion, which is growing the business. We do this through a unique combination of machine intelligence and an elegant UX delivered through a two-sided platform to our institutional partners. You can think of it as a digital CFO for business owners and a great targeting tool and relationship deepener for banks. During our time with MassChallenge, we've continued to build out some important features on both sides of the platform. We also hit a major milestone by closing our seed funding round with an amazing set of investors, and our MassChallenge partner was a huge help in that process. Our partnership with MassChallenge has been a huge boost for us, and we are super excited to work with forward-thinking banks as we continue to reinvent the banking experience for business owners. And if that mission interests you, we'd love to chat.
Hi there, this is Mehmet, the founder and CEO of MyGenie. Our state-of-the-art loyalty platform is designed to help companies to engage and delight their customers through their mobile apps. Point programs, location alerts, cashback offers, birthday promotions, even Facebook likes. If marketing people can imagine, then they can create them in minutes. With our interfaces with Visa and MasterCard, notifications of the rewards earned can be sent whenever consumers use their cards. Thousands of retailer offers are already uploaded to our platform and are available to the end consumers. So what we created is not just a FinTech solution, but a complete ecosystem for better customer engagement and shopping experience. We're now working with 3 clients: a bank with MassChallenge, a company in California for sustainable donations to local causes, and a university for students, alumni, and faculty. So why wait? Reach out now to delight your customers and increase your revenues.
The sum of the insight and knowledge within a business is often held in the models that are used. These could be spreadsheets, AI models, database models, etc. The problem companies have is in operationalizing these models. Too often, they sit on desktops and add very limited value. We use our cloud-based software product, Acumen, to overcome these challenges at a much lower cost than any other method available. We can convert Excel spreadsheets, Python, R, and many other model types instantly. We are already adding massive value to our clients with this approach. We help companies to realize value by turning their models into operational systems, making AI, automation, and machine learning available to all types of businesses. This helps them to increase their sales, to reduce their claims, increase efficiency, and improve overall profitability. I am Danny Katz from Optalytics, and we work with major insurers and banks to solve problems.
Hi everyone, my name is Sjoerd Leemhuis and I'm the founder and CEO of Audin. Our natural language processing platform is used globally to identify emerging risks, opportunities and trends that are hidden in the news. We have partnerships with the big rating agents and Big Four consultants that all rely on our technology. We're having great fun being part of the FinTech cohort of MassChallenge, and it has proven to be useful to connect with the community as well. We connected specifically well with John Hancock and KPMG, so we're also proud to announce that we're about to enroll in agreements with both partners. Next to this, we keep on receiving good feedback and have made tremendous progress on our new platform. The scheduled release brings our mission to shape a better informed world to a whole new level. We're looking forward to the rest of the ride, and if you would like to ride with us, please drop us a message via aulin.com.
Hey everyone, my name is Christian Zimmerman and I'm the co-founder and CEO of Coins with a Q. Coins is a financial wellness platform that's helped consumers pay off debt and save money efficiently without having to think about it. We've put in a lot of the work to help you build those better habits so you can pay off debts much faster, save money on interest, and overall help you become debt-free. Today, we've paid off over $16 million nationwide. And this year, we've been very excited to be part of the MassChallenge program to work with credit unions and FIs to help their consumers also do the same. We're looking to build out more partnerships going into this new year. So if you're interested, feel free to reach out to me at christian@coins.io. Thank you.
Over the past year, we've all seen the tremendous impact the pandemic has had on the retail industry. And it's affected not only retailers and restaurants, but all other commercial real estate stakeholders as well. Retail Market Point is a prop tech firm that provides commercial real estate professionals a common language, a brand score, to evaluate retail properties. Think of it as a FICO score or credit score for retail real estate location quality. I'm John Rafferty, the founder and CEO of Retail Market Point, and we use machine learning to provide location solutions for real estate owners, brokers, landlords, lenders, and investors, all delivered on a cloud-based mapping and analytics platform. We're a partner with Moody's Analytics on their commercial real estate information network, and through MassChallenge FinTech, we're also partnering with KPMG in offering our solutions to their clients. Retail Market Point is actively exploring additional partners and investors to further extend our geospatial reach. I hope you'll check us out. Thank you.
Hi, I'm Tyler N., founder and CEO of Retirable.com, where we're delivering professional financial advice to the 50 million people approaching retirement who don't work with a financial advisor. To start, our platform overcomes the inaccessibility that people feel when it comes to financial planning by delivering answers to their most pressing questions and collecting data across their income, housing, assets, debts, and healthcare. From there, we deliver a free holistic financial plan that guides them through the different scenarios of their retirement, aggregates their data, and allows for the customization of goals to help personalize their retirement plans. Every user has the ability to speak with a real human CFP to discuss ways to improve their plan or work through the big decisions around things like Social Security, Medicare, housing, and income. The next phase of our journey will help retirees implement those plans with a best-in-class decumulation tool, traditionally reserved for the wealthy, and a platform of products and services to help them achieve their best possible retirement. You can learn more at retirable.com.
Hello, I'm Sherry Noonan, CEO and co-founder of Rialto Markets, a FINRA-registered broker-dealer and alternative trading system. Rialto Markets democratizes private markets by expanding the breadth of participants that can purchase private investments, as well as the depth of those investments available. Although we do work with large institutions, we know that there are significant barriers to retail investing in private markets. We open up these markets to all investors by providing issuers with all regulatory, operational, and technical infrastructure required to offer securities via a Regulation A or CF offering. We also work with institutions to offer private investments that can be fractionalized to the public in a cost-effective manner. Rialto Markets finally expands the actual investments that can be scaled, deepening market opportunities. We work with platforms and issuers to make alternative investments such as music catalogs, cars, art, and other diversified investments available to the investing public. Thank you so much.
Hello, MassChallenge. My name is Ali Ahmadi, CEO of TCare. And at TCare, we de-risk long-term care insurance by helping family caregivers with their needs and challenges, assessing their risk and preventing their burnout. We delay placement of elders into nursing homes and help managed care organizations and long-term care insurance companies and some state agencies prevent the burnout of family caregivers. Since the start of this program, we have grown twofold. We now have 72 full-time employees. We're available in 46 US states. And since the start of this program, have added 6 additional long-term care carriers on both the Medicaid, Medicare, and financial services insurance side to our list of clients. We appreciate all the help with MassChallenge and looking forward to future relationships. Thank you.
Hi, everyone. Jenny Bruckman here, VP of Customer Success and Strategic Alliances at Wevo Conversion. Wevo is a platform solution that provides rich qualitative insights at quantitative scale to rapidly diagnose digital experiences. I'm pleased to say that we're having a banner year with near 300% year-over-year growth. And that's entirely because we're able to help so many agency partners and brands across e-commerce, financial services, higher education, and more expand their insights and democratize their research. We're able to help them optimize faster by standardizing processes and pinpointing why visitors are not converting on their digital experiences. We're helping them to accelerate revenues and save time by validating ideas. And we're helping them reduce risk of evaluating their own experiences and ideas as well as competitor experiences. We're so excited to be able to continue to build out our human augmented AI capabilities and product offering for our customers so that we can continue to help stakeholders create data-driven and insight-led organizations. Cheers to a great year ahead.
Hi, my name's Omar and I'm the co-founder and CEO of WorkScope. Our business exists so that organizations can understand the risk and significance of their shadow IT. Our first use case lets organizations understand how spreadsheets are used on the ground in real time. And this allows them to automatically improve the visibility they have on risk and controls and spot things like data, process, or even key person risk. And it allows them to understand where they have too much human capital tied up in manual or legacy processes. The MassChallenge initiative has allowed us to partner with financial institutions and understand their specific pain points around shadow IT and how they might use our product. And when you see this live, it gives you ideas on where we can enhance the platform and reduce as much manual work as possible. It's also allowed us to improve and refine how we onboard at financial institutions, which is always a complex task. And most importantly, it's allowed us to build relationships with potential buyers for the future. Thank you.
More than 50 million adults are responsible for an older parent. You might know someone who is. For them, coordinating, planning, and paying for this chapter of life brings an enormous burden. It's nearly impossible to know where to start or feel confident in your decisions. And for most, the cost is an even bigger shock. Worthright provides planning and financial assistance for family caregivers. Our free product allows you to explore different options and decide how you'll fund them as a family. We surface up to 12 different options, helping you make use of the assets you've accumulated, not just selling them. If someone isn't sure where to start, we'll pair them with a licensed advocate to assess their situation at home and create a responsible plan, no matter where they are in their journey. If you're listening, Chances are you know someone who's responsible for an older parent. Please refer them to Worthright so we can help them today.
That flew by. I hope you learned as much as I did. These companies are literally the future of the industry. Speaking of, we hope you'll join us for the main event, beginning now, where we'll look at the future of health and wealth and the innovations taking us there. See you soon.
Health and wealth. Two things we seek in order to live fuller, more fruitful lives. And in 2021, amid the fight for social justice and an unprecedented global pandemic, two things that seem harder than ever for so many to maintain. But here at MassChallenge, we see an opportunity. An opportunity for continued innovation in healthcare and financial services, groundbreaking, earth-shifting, unconventional innovation that will not only strengthen the industries themselves, but the connections between them. Connections that are critical to shifting how we approach and address health and wealth in the future. From enhanced telehealth efforts to a renewed focus on at-risk populations. From helping small businesses navigate PPP loans to building inroads toward financial literacy and wellness. This past year, some of the best and brightest health tech and fintech companies have been collaborating with industry-leading partners to solve massive challenges.
We are thrilled to be partnering with MassChallenge. They're passionate about helping startups succeed.
By working with these champions, we were able to successfully identify the route that we wanted to go as a company.
Getting that exposure, being tapped into that network, and getting that kind of stamp of credibility, I think, is really important.
At MassChallenge, we connect startup founders to corporate execs, experts to innovators, technology and solutions to those who need them most. So welcome to a new way of thinking about and advancing health and wealth. Welcome to the 2021 MassChallenge HealthTech and FinTech finale.
Welcome everyone to the 2021 MassChallenge HealthTech and FinTech finale! Tonight, we're celebrating the bold ideas and the entrepreneurs and the industry leaders from around the world that bring them to life. A little bit about me, I'll be your host for the evening, Chris Denson, host of a lot of other things, including Fast Company, Cannes Lions, and my own series, Innovation Crush. And I also do a lot of work in the industry, most notably run the innovation practice for MullenLowe, a Boston-based agency. So I'm a good neighbor, even though I'm all the way here in Los Angeles with my plants. What year is it again, man? I can't believe it. It's hard to believe we're already halfway through 2021, a year that has continued to reshape how we view ourselves and our communities and our pasts and our futures. And a big piece of that shift in perspective is why we're bringing two distinct communities together today, financial services and healthcare. Now, we've always known that they share a lot of commonalities, both highly regulated, both deal in vast amounts of personal data, and both are entrenched in many, many legacy systems. But the pandemic has increasingly illuminated the ties between the two in even more ways. From long-term healthcare solutions to AI to hyper-personalization, tonight we'll explore more of the common connections between FinTech and HealthTech and opportunities at their intersections, and most importantly, the startups tackling massive challenges within these sectors. If you missed our pre-event featuring pitches from the MassChallenge HealthTech and FinTech cohorts, shame on you. But I absolutely hope you'll take the time to learn more about this year's startups in the cohorts by clicking the event brochure button above the streaming window. They're truly the future of these industries and the reason we're all here tonight. In the past, many of you may remember that tonight we usually hand out cash prize to select startups. MassChallenge mixed it up this year to pilot a little bit more of an equitable approach. In addition to their zero equity, no cost model, every single startup in this year's program received a stipend mid-program to fill any enterprise readiness gaps like compliance certifications and product development needs, just a little extra cash to help them get through these challenging times, right? As we celebrate the startups from this year's MassChallenge FinTech and HealthTech programs, I ask you to consider how you can support the next generation of entrepreneurs. There's no time like the present. Scroll below this video to get involved as a donor, a mentor, a partner, or an investor. We need you all. Now, with that said, let's get on with the show. Over the next 60-ish minutes, you'll gain insights about collaborative innovation within financial services and healthcare and what's ahead for the future. You'll also hear from our keynote, Brandon Dewitt, co-founder and CTO of MX, about the transformative power of entrepreneurial thinking. And then you'll get a front row seat to a fireside chat between Marla Blow, president and COO of the Skull Foundation and founder of FS Card, and Sheila Lirio Marcello, founder of Care.com and venture partner at New Enterprise Associates, moderated by AARP Innovation Lab's very own VP of Startup Programming, Jacqueline M. Baker. And most importantly, you're here to celebrate with us the MassChallenge FinTech and HealthTech startups, all they've done and all they will do for the future of these industries and the world at large. Be a part of the conversation. Join us on Twitter with the hashtag MCFinale and hashtag Health and Wealth. Post pictures of you watching the event, give shout outs to your friends and your fellow entrepreneurs. Look, we've got a lot of ground to cover, so let's get started. Please join me in welcoming the CEO of MassChallenge, Siobhan DeLay.
Thank you, Chris, and welcome everyone to the 2021 MassChallenge HealthTech and FinTech Finale, celebrating innovation in health and wealth. My name is Siobhan DeLay, CEO of MassChallenge.
And I'm Devin Sherman, Managing Director of MassChallenge FinTech and HealthTech. As Siobhan mentioned, tonight we're here to celebrate all of you who are fearlessly innovating healthcare and financial services. So I want to extend a massive thank you to all of our champion partners for making our program possible, and a big congrats to all of our startups for making the most of this opportunity and driving toward meaningful results. I also want to thank the hundreds of community members who generously dedicate their time to helping us source and judge the best startups who share their expertise as speakers and advisors during our program. This year, our HealthTech and FinTech program saw over 700 companies apply from across the globe. With an acceptance rate of only 8%, we welcomed 30 startups per cohort from 8 countries in 21 states. Over half the HealthTech and FinTech cohort companies are minority-led, and over half the HealthTech cohort is female-founded. Since January, we've generated nearly 80 enterprise startup partnerships, and 2/3 of those have either already launched or are on track to launch a pilot by year-end. It's been incredible to see the intellectual tenacity and creative problem-solving that our FinTech and digital health communities have contributed every day for the past year. And we can't wait to see what our startups and partners continue to accomplish after our program.
This year, we're also celebrating 2 big milestones. 5 years ago, we started MassChallenge HealthTech. For those of you who have been with us for the whole 5 years, it used to be called Pulse at MassChallenge and was located over near Fenway Park. MassChallenge HealthTech is our first ever later stage challenge-based program. And 3 years ago, we launched MassChallenge FinTech. In fact, you may have been one of the 400 people we brought together to kick off the program in the beautiful old John Hancock offices during Boston FinTech Week. These 2 programs were built upon the firm belief that collaboration between large organizations and emerging startups is essential to innovation in healthcare and financial services. So over the past 5 years, MassChallenge has worked to facilitate startup enterprise partnerships and help both overcome barriers to innovation in order to advance the industries together. Over these past 5 years, we've also seen how much healthcare and financial services are linked, which brings us to today, where we're bringing together the 2 programs to celebrate and explore innovation in health and wealth. As we've learned over this last year, innovation in health and wealth is critical to the pandemic recovery at large, and the work being done by the HealthTech and FinTech entrepreneurs is central to this. Thank you for your efforts, and thank you for being part of the MassChallenge journey. We're excited to get all of us together shortly and safely in our new, soon-to-be home at MassMutual's Seaport offices. Until then, enjoy the celebration. Back to you, Chris.
Thanks, Siobhan. Now, as we've been saying, there's a lot of overlap between healthcare and financial services. We'll also be saying health and wealth a lot, and healthcare and financial services a lot. But if you tweet the right count at the end, you might win some sweet swag from our partners. So the home of MassChallenge HQ, Massachusetts, is known for both FinTech and HealthTech, with Boston consistently ranking as one of the top medical cities in the world, as well as a top city for finance professionals. We're so honored to welcome a key leader in Massachusetts driving that success. Please help me in welcoming Massachusetts Governor Charlie Baker.
I want to thank you, Chris, for that introduction. While I know we all wish we could be together in person, it's still great to join you virtually at this year's MassChallenge HealthTech and FinTech finale. It's a mouthful. Each year, this event is a great opportunity to recognize the hard work and exciting ideas of the startups supported by MassChallenge and to celebrate our world-renowned innovation economy. In Massachusetts, we're fortunate to have so many leading companies, academic institutions, and partners like MassChallenge operating on the cutting edge, driving the development of life-changing discoveries, as well as the growth of high-paying jobs across our Commonwealth. Now more than ever, as we continue to navigate the pandemic, our innovation economy will be critical to ensuring that we keep our population safe and poised for a strong recovery. Thanks in large part to the vision and tireless efforts of the folks at MassChallenge, our digital health and financial technology industries are well prepared to play a key role in this work ahead. Our administration's been proud to work closely with MassChallenge to ensure that both sectors remain global leaders, especially as Massachusetts companies continue to lead the way in our fight against COVID. As we progress in this fight and move toward a new normal, we're excited to host the Health 2021 conference in Boston this October, bringing together leading voices across the health ecosystem and demonstrating our strong leadership in health tech and healthcare generally. And last year, following our identification of FinTech as a key industry in our economic development strategy, we convened a working group on the growth in FinTech here in Massachusetts, led by Secretary of Housing and Economic Development Mike Keneally and MassMutual U.S. Head Mike Fanning. The two Mikes worked tirelessly on this, and it led to an announcement in March of the launch of the Mass FinTech Hub, which will more effectively convene key players in the industry to increase venture capital invested in local startups while helping to attract and retain more entrepreneurs in this fast-growing space. And while we're very proud of the fact that almost 1 out of every 10 FinTech startups launched in the U.S. in the year before the pandemic was based in Massachusetts, we know we have a way to go to catch up to peers like San Francisco and New York, and look forward to the FinTech Hub playing a key role in moving us forward. It goes without saying that this last year has been a long one, and on behalf of our administration, I want to say thanks to everyone at MassChallenge for your hard work to continue your mission despite all these challenges. I especially want to offer my thanks to MassChallenge CEO Siobhan DeLay and Managing Director Devin Sherman for your leadership and partnership over this very difficult year. I also want to congratulate each startup being recognized tonight for your participation in the program and wish you luck as you move to the next stage of your growth and development. We all look forward to seeing what you can achieve, whether it's here in Massachusetts, across the country, or somewhere else around the world. I want to thank everybody again for their participation, and I hope you enjoy the rest of the program, and I hope we have a chance to get together in person at some point soon.
Thank you so much, Governor Baker. Your leadership is tremendous in advancing innovation in the state, and agreed, I think everyone watching is looking forward to getting together in real life soon. I'm personally tired of having strangers in my bedroom every day, right? Now, as many of you may know, the MassChallenge FinTech and HealthTech programs match seed Series A startups from across the globe directly with organizations to work together over the course of the 6-month program, from January to June. MassChallenge provides support throughout the course of the relationship to help startups become more enterprise ready and to help corporate partners become more startup ready. 2021 marked the 3rd year of MassChallenge FinTech, so let's hear from some of this year's FinTech startups, partners, and mentors.
What MassChallenge FinTech does, specifically in terms of trying to help organize and bring the right stakeholders to the table is critical.
Being able to work with MassChallenge and work with the great partner that we had, being able to associate ourselves, with those types of organizations is incredibly helpful. We talk sometimes about innovation theater at some of these large companies, and that's certainly not the case with MassChallenge. Folks who signed up for it, clearly want to get something out of it.
Our firm has incredible resources at its disposal, but by definition, no one person or company can be the best at everything. So exploring innovation externally through our relationship with MassChallenge will keep our firm plugged into a wide range of new ideas and approaches to solving our business problems.
You're creating something better, more efficient, cleaner, cheaper, and you're doing it in a such lucid, clean, and elegant manner that it's hard to believe life after the fact, of why it was ever so inefficient to begin with. I think that's what entrepreneurship is about.
A year ago, the entire program sort of got flipped on its head. This year's program, instead of sort of, shying away from that, really leaned into it and actually came up with, I think a set of products and services that really will sort of help lead us into sort of the new normal as we emerge from the pandemic.
We've seen a lot of people struggle this year. To the extent that technology can help bring financial wellness to broader swaths of the population in this country and globally. I mean, to me, it seems like a pretty critical mission.
By 2053, African Americans are projected to have a negative net worth. By 2073, Latinos are projected to have a negative net worth. And yet, kids who have savings accounts in their name are 6 times more likely to go to college and 4 times more likely to own stocks by the time they're young adults. If we want to change America, we have to remove the barbed wire around financial literacy and financial education. We've got to change how we are approaching the solutions that we bring to Americans and to kids and to families.
And I think people are really invested and interested in learning about taking charge of their financial future in a way that they hadn't before, not because they weren't interested, but because they couldn't sort of put it together themselves in the same way.
Technology is great. It's doing a lot to automate and make life easier for people. But financial services at the core is about human interaction. Companies that were human first in nature are really trying to push us to not disintermediate, not disrupt, but truly empower and enable humans to deliver better experiences.
Our well-being is multifaceted. It's everything from my physical well-being to my mental well-being to financial well-being. So I think if we're as partners can continue to focus on this and zero in on this connectivity between health and wealth, we're in a nice position as an industry to make a difference for the consumers.
We can get really comfortable just kind of knowing what we know, but I think that there's just a tremendous opportunity here to kind of go into the unknown. We need to continue to push the envelope on innovation, work with startups that meet our customers' ever-changing needs.
Wow, what amazing feedback from that group. Now look, what's been your favorite memory of MassChallenge FinTech? Let us know via Twitter with the hashtags MCFinale and hashtag Health and Wealth. Now, one of the biggest challenges within both healthcare and financial services is data. Lots and lots of sensitive data. Or is it data? Or is it GIF or is it GIF? Anyway, you know what I'm talking about. Especially our Keynote knows all about it. MX is a Utah-based fintech company that focuses on automating the money experience through data in order to empower the world to be financially strong. Co-founder and CTO Brandon Dewitt founded the company in 2010. 6 years later, his company used the very principles they were applying at work to help him in a very unlikely way. I hope Brandon's story pushes all of you watching to think more about how an entrepreneurial mindset can be leveraged creatively to impact in more ways than one. And without further ado, here's Brandon.
Hi, I'm Brandon Dewitt, co-founder and CTO at MX. First and foremost, I want to thank MassChallenge and Chris for having us today. And I'm excited to be here to talk to you not only about my entrepreneurial journey, but also what is waiting out there for all of you on this incredible journey of building new things for our world. A little bit about me, I actually came up through some really interesting pathways to be an entrepreneur. First and foremost, I was a music major in college, ended up getting a computer science degree because somehow the music department at the university that I went to was linked to the computer science department, and we had a lot of crossovers in different ways. And so I was very interested not only in the creative side of building music, but also I was very interested in the computational side of things that are going on with computers and how that's pushing forward all different areas of humanity. So I got out of college and I started working for a company that now today is called Experian, largest credit bureau in the world. And I got to see inside the banking system and inside the FinTech ecosystem that there's a ton of opportunity for new ideas to be created and to change how we interact with our finances and our money. And I got to see that a lot from the standpoint at Experian. And so you work a lot with credit bureau data, you work a lot with credit, you work a lot with banks. And so it allowed me to understand that there are some problems that weren't currently being solved. So a friend of mine and I decided to start a company, and we started a company that was really focusing on budgeting. At the end of the day, we raised a little bit of money. We started building that software, and about 15 months into that journey, we had a couple of different offers to buy our company. And so we ended up taking one of those offers and merging with a company out here in Utah called Money Desktop with Ryan Caldwell. And we ended up rebranding that as MX, and kind of the rest of that story, I guess you could say, is history. As we've grown to now over 600 people, we've raised over $475 million. We have amazing investors like Capital G from Google and TPG and Battery Ventures. It's just been an incredible journey, but all along the way, there are incredible highs and incredible lows. That is the entrepreneurship journey. That is the hustle that you're after every day. I've definitely had my ramen days where you can only afford to eat ramen. Thankfully, you might be able to buy some eggs to put in it to give you some protein in that ramen. But still, at the end of the day, it's been incredibly rewarding to see a team be built that now, quite frankly, could probably execute just as good with me here or with me not here. I mean, it's actually kind of amazing to go about the process, not only of building a product, but as you're thinking about your entrepreneurial journey, don't just think about the product, think about the team as the product. Because as you build a team and as you build a culture, the eventual hope is that you build something that can sustain itself. And at MX, we've been so fortunate to have incredible individuals choose to join our team, choose to build with us and create with us. And I think that we have done a great job of setting up a self-sustaining culture and a self-sustaining company that continues to grow at an incredible rate year over year. It's a very difficult pathway, but I don't know if I could do anything else in my life. I had a bit of a unique journey over the last 10 years, actually, as we have been building MX, because as you're building your team, as you're building your product, as you're growing your company, there are things that happen and life can get in the way. And actually, one of those things happened with me on my 33rd birthday, about 5 years ago. I was diagnosed with stage 4 cancer with metastasis to my lungs. And they found 18 tumors throughout my head and my neck and my lungs and sat me down and said, "You're not going to live 90 days. This is the end of your journey and there's nothing that we can do about it." The incredible thing that happened at that time was the team here at MX came together and just started pouring over data. I mean, I am truly in awe of how Google and other search engines have been able to index the world of data such that if you don't know anything about a subject like cancer and you're fearful of it, you can dive in and you can learn so much about it over a series of days that you can then begin to find scientists and doctors that are working on the cutting edge of solutions for these problems, and you can begin to talk to them in intelligent ways and begin to understand how they're pushing forward the new world of cancer therapy. And so I was incredibly fortunate because our team got together for several days, came up with a plan to visit 16 different cancer centers and doctors over the next 30 days and try and find a solution for what were being told at the time was an incredibly short prognosis. And so we flew from one visit to the next, and if you think raising money for a new startup is hard, you should try and find a scientist to save your life. It is a very difficult journey. It is very emotional. You get a lot of no's. You get people that say, man, we would try that, but it's just not worth it. Your disease is too advanced. And so I was extremely fortunate that two of the people that we spoke to on that journey said, we're willing to try something. We can't guarantee it's going to help you. We can't guarantee that it's going to keep you alive. We can't guarantee that it's going to, even hurt you in a significant way. And so, but we are willing to experiment. And so I was extremely fortunate that we found those individuals, because at the end of the day, one of those experiments was up at University of Washington, or Fred Hutch, which is the cancer center up in Seattle. And what they were doing up there is they had brought together really what I would say is the intersection of computation and healthcare. And they were sequencing tumors and finding out the DNA of tumors. And they were determining that when they actually hit different types of tumors with different types of treatments, the types of expressions that would then follow. And so they determined that if they gave 2 drugs in sequence, that they believed that it would actually result in more cancer cells dying than if they gave them at the same time, or than if you took them separately. They wanted them to be in a specific sequence. And so I was very fortunate to be led into this trial. And after about a year on that trial, about 15 of my tumors had just melted away. And I was obviously still alive today, had more than 80% of my tumor burden go away. And I've been on this incredible journey, but really where it all started was this idea of how do you get as much data as possible about everything that we can know about cancer? How do you get the DNA sequencing? How do you understand the mutations? How do you understand when you hit the mutations with different drugs, what happens as a result? And storing all of this in databases that can then be combed over by programs that are trying to actually come up with new chemicals and new treatments for cancer therapy. I am an incredible beneficiary of hundreds of millions, if not billions of dollars of investment in this field, and new ideas and creators and scientists and new companies that have come up with new ways to sequence, new ways to store data, new ways to process it in parallel. I'm the incredible beneficiary of that, because all of this coming together, and I like to say the world conspired on my behalf. So this entire conspiracy on my behalf still has me alive today. I still have cancer. I still am on treatment 5 days a week. That's okay. I live a great life. I'm still able to contribute to what we do at MX. But at the end of the day, the incredible amount of investments that's been made by startups, by venture firms, by research facilities, by building out new computation, fundamentally at the end of the day has saved my life. And it's sustained my life in an incredible way and given me a quality of life that when I was diagnosed, I never expected. And so I do think, as you are all out there thinking about new ideas that you're going after, new things that you're creating, there are bigger things in this world than just making money. And I think that it's really important. In fact, one of the books that I enjoy reading is by an English economist, John Kay, called Obliquity. And one of the things he talks about is money is a follower, it's not a leader. It's something that comes oblique to the goals that you are trying to achieve. And I think as individuals are out there trying to do new things with cancer therapy, trying to do new cataloging and storage of healthcare data, trying to process it in an incredible way, you have to think about the outcomes that we can have instead of the money you can make. And I promise the money will follow, because as you focus on the things that are important, impacting humanity, changing and serving our society, money's a follower. And it will follow as you make an impact in those incredible ways. I'm incredibly excited just to see all of the new ideas and new companies that are coming out of MassChallenge, because I know they're going to change the world in a significant way. When I think about impact and I think about MX, obviously we've been building a business for just over a decade now. And when we contemplate, both from our beginning up until now, what we do and how we do it, for us, it's all about data. How do we get together data? How do we bring it together in a platform that it can be leveraged by other people? And what's kind of fascinating to me is that we're not necessarily always building something for the end consumer outcome. We understand at MX that we're not going to come up with every great idea in the world. What we want to do is we want to build a platform that stores and catalogs that data in such a way that it becomes useful for others, so that other companies can build on top of it experiments that we could never come up with. There's an incredible number of ideas out there. There's as many ideas as there are people about how you should manage your money, about what the future of FinTech should look like, about how money movement should take place and what we should actually have as far as regulatory guidelines or guardrails to help us. But what's incredible is when we at MX have built this incredible data platform, we get to then watch as new entrepreneurs build new companies on top of it, as new ideas manifest on top of that through this incredible amount of experimentation. At the end of the day, it's going to take hundreds, if not thousands or tens of thousands of companies and ideas building on top of the data that comes from our financial infrastructure in order to change the world in any substantive way. It's not going to be one company. It's going to be hundreds and thousands of ideas and builders that are building on top of that. So when we look at impact at MX, we say, how do we serve those idea builders? How do we serve the creators that are going to be building on top of the data that we bring together? And that is an incredible amount of stewardship, because we then know that the next step is thousands, if not millions, of consumers that are coming through those companies and those experiments and then touching our platform in some way. There's an incredible amount of stewardship when it comes to the financial lives of individuals. And so we are extremely fortunate here at MX. We take every single day seriously, because it's our opportunity to help empower new builders that then help change the world for the better. When we think about the future of MX, even investing now in 2021, one of the things we announced at the beginning of the year was we had raised $300 million in capital. And we get asked all the time, what are you going to do with that amount of money? At the end of the day, the way that we view our opportunity here at MX is to invest in data and data platforms for us to be able to connect the world of financial data. We are going to double down on that investment in connectivity. There is a sea change happening right now in how open banking and open finance are coming together here in the United States. The largest banks in the United States are opening up APIs. It takes an incredible amount of infrastructure to be a steward of that data. There's also an incredible investment that's happening in other banking software providers that is manifesting in open banking and open finance. That data is being connected in speed and in ways that we never comprehended before. We're going to continue to double down on that connectivity. We're also looking at how we apply things like artificial intelligence and machine learning on top of that data. Because once you have a large enough corpus of data, 50, 60, 70 million users worth of financial data, the ability to then create what I would say is the autopilot of finance on top of that data becomes more and more realistic. But it takes an incredible amount of investment. We're going to do that at MX in the fields of AI and ML, and we've been growing our data science team for a couple of years now. We're going to more than double it in size this year. I'm really excited about that. For myself personally, my journey of cancer continues. I'm on an incredible trial right now that has been keeping me alive, but also with everything that has happened with COVID, with the ability to create vaccines in this incredible speed and special way. One of the big things happening in cancer right now is new vaccines towards specialized therapy, where they sequence your DNA and create a custom vaccine. I've been fortunate enough to be let into a trial where they're creating a custom vaccine for my type of cancer to see if it impacts it in any substantial way. I'm really excited about that because it brings together, once again, technology and health at the same time, and making something that's possible that was never before possible. A completely custom vaccine for a human being, for their DNA, for their sequence of data. It truly is amazing, and years ago would never even be thought of. But with all the investment in this technology recently, it is becoming a reality. I'm excited for that personally. I'm excited to see how that manifests and how it potentially changes the world of cancer therapy. I've been incredibly blessed and lucky to not only make it this far in my entrepreneurial journey, but also to make it this far on my own journey, as I've been told many times along the way that my prognosis was not positive and it wouldn't be happening. And so as I continue not only to build great things at MX, but also to invest and build things on the health side, I look forward to how those investments might pay off in an incredible way for humanity.
That is proof positive that the entrepreneurial mindset can get you through anything. Coming up next, we have a really incredible fireside chat with Marla Blow, Sheila Lirio Marcello, and Jacqueline M. Baker. But first, we have a very special anniversary to acknowledge. Happy birthday to ya. Happy 5th birthday to MassChallenge HealthTech. In MassChallenge, 5 years is like what, 25 years? Look, MCHT originally launched as Pulse at MassChallenge 5 years ago. And with a grand collaborative vision between payers, providers, pharmaceuticals, government, and MassChallenge, and so much impact has been made since then to improve the lives of patients everywhere. Let's take a look and let's celebrate.
I feel privileged to have been part of MassChallenge HealthTech from its early days when it started as Pulse, sitting in judging rooms where you can meet colleagues from Philips and Takeda and MassGen and Brigham. That type of conversation is what healthcare needs.
Every event I've been to, as you enter the room, you can just feel the energy, like let's do this.
What's been really amazing to me is the way that MassChallenge and the HealthTech program have evolved. Over the years, we've added a ton of great programs.
MassChallenge has done a phenomenal job of really just bringing in leaders from across all the different sectors to think about things.
It accelerated relationships in ways that would have taken us, I think, months or maybe even potentially years to kind of build out.
The value proposition is very strong to really help not only the founders, the early stage, but also the big corporation to incorporate the innovations, the new vision, the fresh idea.
The reason you start a company is to create value. And there's a lot of ways to do that, but that's the biggest thing that keeps us going, is being able to build something that creates value for our users.
How can we mitigate some of these barriers that prohibit people from gaining good access to care? What is the impact of where you live, the impact of how you access your care?
Caregiving is one of the areas where the inequities are really, really dramatic. If you're a Hispanic woman, the amount of out-of-pocket spend, if you're a family caregiver, is about 44% of your net income. If you're a white woman, it's about 14%. These are just massive issues, and I think it's one of the areas that needs help and support.
Equity really has a lot to do with access. We've been giving information in one way for such a long period of time. Diversifying those streams and the way that you educate people around what those options are a really, really big part of it.
If there's one thing to say about a silver lining to all this, it's just sort of the sped up adoption, or the accelerant of working in these sort of digital and remote ways. And that's exactly what a lot of these companies are building, solutions that can be deployed and deliver care or track symptoms.
We can expand access to care that maybe was limited in the past, but we also can't stop there. We have to use technology to actually improve health, to improve the service that we provide.
There's this convergence of want to do social good and technology that has the ability to churn through massive amounts of data that we couldn't do before. I think everybody wants to do something that will make an impact.
The path
to prosperity is paved by perseverance. You got to hang in there, and I feel that spirit in MassChallenge HealthTech.
Wow, what an amazing 5-year journey this has been. Take a moment to tweet your favorite MC HealthTech memory at MassChallengeHT using the hashtag MCFinale. And if you're feeling particularly inspired, please consider supporting the next generation of HealthTech and FinTech entrepreneurs by donating a gift of any amount to MassChallenge on this page below. Together, we'll continue nurturing individual entrepreneurs and delivering broad societal benefits at scale through the power of entrepreneurship. Because that's what's so exciting about working with MassChallenge, right? Connecting with so many entrepreneurs is a constant source of inspiration and stories. We all know every entrepreneur has lots of tales from the archives, lessons learned, and epic fails and historic wins. Marla Blow, founder of FS Card, and Sheila Lirio Marcello, founder of Care.com, know a little something about all of that. I'm excited to welcome Jacqueline M. Baker, VP of Startup Programming at MassChallenge HealthTech and FinTech partner AARP Innovation Labs to kick off this conversation. Thank you, Jacqueline.
Why, thank you. Absolutely, Chris. It is such a pleasure to be here with you all today. I look forward to this dynamic conversation. I'm Jacqueline M. Baker, and I have the opportunity to serve as the Vice President of Startup Programming within AARP Innovation Labs. And within the work that we do there, we are always uniquely looking to discover some of the best and brightest FinTech and HealthTech companies, and quite frankly, also the intersection of those 2 points, which is why today's conversation is so incredibly exciting. I get the opportunity to talk to 2 leaders in their respective spaces. Let me take a moment and introduce our dynamic panelists, and then we'll get into today's conversation. Marla Blow is the president and COO of the Skull Foundation, where she leads Skull's program work, grants, investments, and financial management, including operations endowment and portfolio partnerships. Previously, she was North America lead at the MasterCard Center for Inclusive Growth. And before MasterCard, she was founder and CEO of FS Card Inc., a subprime credit card venture sold to a strategic acquirer. So Marla, once again, thank you for coming to today's conversation.
Thank you.
Absolutely. So next, I get the opportunity to welcome Sheila Lirio Marcello to the conversation. Sheila is a venture partner at New Enterprise Associates. Prior to NEA, she started Care.com with the conviction that technology and innovation can address real-world social challenges in 2006, and served as chairwoman and CEO until early 2020. With Sheila's leadership, since founding, the company had year-over-year growth of over 100% prior to going public in early 2014 and was sold to IAC in early 2020. So once again, welcome to you, Sheila. I'm looking forward to today's conversation.
Thanks, Jacqueline. Excited to be here.
Okay, so let's dig into what we know everyone came here to learn. We're talking about the intersections of health tech and fintech, healthcare industry, and also financial services industries. And there are lots of very unique intersections that happen. But first, I am very curious, Marla, if I could go maybe a little bit personal for a second. You've had a unique and deep history in the financial services space. Of the spaces that you could have explored, tell us, why financial services?
You know, for me, financial services and I guess money has really been one of the themes throughout my life. I was that kid that had an allowance and had a budget and had a plan for my allowance since the time I was probably 5 or 6 years old. And I grew up in a German neighborhood, actually. We lived in Germany for a number of years in my early childhood. And by that, I mean we lived in a German neighborhood, as in we were the only Americans there. And so I became aware of currencies and became aware of, at that time, the Deutschmark, which I may be dating myself by even mentioning that, but versus the US dollar. And I spent a lot of time understanding exchange rates and what I wanted to use my allowance for and whether I wanted my allowance in Deutschmarks and dollars. And so from that little beginning that extended all the way through to my adolescence when I lived in Atlanta, and I thought, you know, there's a community here. I was in a middle class, kind of, middle income Black community in Atlanta, and that was the first, probably one of the first times that there were kind of significant middle class Black people that had a little bit of cushion and had to make decisions about what to do with money. And I observed that, and with the kind of arrogance and confidence of youth, unencumbered by reality, I thought, I can help these people make better decisions, right? I can help middle-class Black people make better decisions with their money. And extended all the way from that to where we are today. And that has been a kind of ongoing focus for me.
Thank you for sharing that. You know what's so interesting? The words that you used, arrogance and confidence, I think those have just been rebranded now in the startup world to really correlate with things like bold and brave, right? But at one point it was looked at as arrogant and confident, but now it's like, oh, you're bold and brave. So thank you, Marla, for sharing that. I look forward to doubling back on a couple of the things that you talked about in just a moment. Sheila, let's jump over to you for a moment. What a great success with Care.com. I'm super curious if you can just rewind back. What was the need that you were looking to solve in the health space when you launched that company?
Jacqueline, I was born and raised in the Philippines, and I came here for college, and I got pregnant between my sophomore and junior year in college. And I didn't really have a lot of access to help and care. My husband's family was deceased. And given that my parents lived overseas, I actually had to ask my parents to come to the United States to help care for our kids. And so, fast forward years later, when I went to grad school, I got pregnant again with our second child and wanted to work in the tech sector, and found ourselves that, it was very difficult to juggle again. We didn't have access to care. So my parents came over, took care of our younger son, Adam, and my father was walking up the stairs and fell backwards and had a heart attack. And so I found myself sandwiched between childcare and senior care at 29 years old, but yet I was working at a technology company at the time. So what was strange was that I was using the yellow pages to look for care, but here I was working on actually a FinTech company called You Promise, helping families save money for college. And I said, well, what could I do to actually help myself? But found that as I peeled the onion, many families needed the help. It wasn't just me. I mean, it ended up being millions and then eventually billions as we went global with Care.com. So for me, it was a real personal passion and need to address a specific issue, because if your loved ones aren't cared for, then it's very difficult to focus on anything in life, whether it's work, hobbies, or anything that you're trying to pursue in your aspirations. So it was something that was sort of near and dear to me and very personal. And that's the reason that we started Care.com, was really my children and my family.
It's really amazing. I mentioned earlier the work that I get a chance to do every single day over at AARP Innovation Labs. And most of the super innovative and super heart-wrenching, and most importantly, the most impactful startups that I get a chance to engage with are those where their solution comes from some personal thing that they're looking to solve for. It also is a very interesting thing right now as I talk about intersections. I'm in an intersection of my personal life where lots of my friends are coming to the stage where they need to care for their parents. And so quite frankly, in the privileged space that I sit and really having a firsthand seat at these dynamic health tech and healthcare companies, and also on the FinTech side as well, I get a chance to refer them to services like Care.com to ensure that they're prepared to care for their parents the way that they want to. So thank you for that, Sheila. Marla, let's talk a little bit back over in your side of the world. What are some of the biggest opportunities for innovation in the FinTech and financial services spaces that could also benefit the health spaces? What's your perspective on that?
Yeah, thank you, Jacqueline. I think it's a really interesting question. I'm right now really interested in this idea of the fact that I think as predicated by the entirety of this discussion in this organization about the relationship between health and wealth, and the fact that it's very difficult to have a stable financial life if your health is out of balance. It's very difficult to maintain your health if your financial picture is out of whack. Those two things feed each other, and I've observed a number of ways where that intersection is starting to come together, where I've started to see things like the Robert Wood Johnson Foundation, which is an entirely healthcare-oriented entity, actually showing up in financial services and FinTech, because even they have started to see the health outcomes, the longevity about life, et cetera, all mixing in there together. So for me, the marrying of these two disciplines, I think especially as it relates to data and intelligence, is the biggest path for changing human decision making, for changing human understanding, and putting people in a position to meet both of those objectives, which is to have a stable and productive health position and financial position. One of the things I see right now is corporations and businesses adopting artificial intelligence and using it quite broadly, right? Right now, I would argue that artificial intelligence is at work in so many aspects of our lives by organizations in ways that we don't even realize when it's happening. But the individual is still making kind of best guess decisions in incredibly complex places. That's at the literal intersection where, for example, you're making decisions about what healthcare package you should choose, how much to put in a health savings account, HSAs. Some of those decisions are pretty complicated, how much insurance to buy. And people are still doing their best to kind of understand it as well as they can, and then pick from a menu, maybe provided by their employer, and hope for the best. It feels like to me we can put individuals in a better place, right? With artificial intelligence, with the access of data and the ability for programming to allow much more informed and much more predictive decision making now. I think the promise of bringing that to the table, right, and putting individuals in a position to be assisted in making their own consumer level, retail level decisions with the benefit of artificial intelligence, I think has profound potential implications for meeting that balance in this arena. So I'm really excited and hopeful that we'll see FinTech startups tackling that and employing data, and analytics and artificial intelligence driven insights to help change that balance of power and put individuals in a position to make decisions as well as corporations and organizations do already.
Jacqueline, I wonder if I could actually build on that. What Marla just mentioned, I mean, as I think about my journey at CARE, I started with really, designing the service with my co-founders as a marketplace to solve a problem, right? To provide our dependents and our loved ones with care at home, which is really what we did on childcare and senior care. But soon, a few years later, we started to realize that the financial side was so critical for families as well. As Marla just pointed out, you can't function without great care for your loved ones, and you can't function if you're not financially stable. And why finance came into place is we started to realize that the number one budgetary item for families was actually care related. And it was just continuing to be a problem and growing. And then on top of that, caregivers were getting paid below minimum wage, and they couldn't function and create a stable enough set of jobs for them to continue to provide the service, because healthcare, and we'll definitely talk about data and tech, right? But without the foundation of being, people, and we're supporting it with people, that it's a sustainable job, then it's hard to actually continue. So we started implementing, different kinds of features to help the caregiver. We actually partnered with MasterCard, with Marla's background, on savings programs, so that they can actually save on a card and take it wherever they wanted, to a pharmacy, to a grocery, right? We started giving them access to insurance, healthcare for caregivers. We were one of the first gig economy platforms to do that. So if you think about it, we were trying to marry not only care for your loved ones, but how could you, even within the care industry, sustain both families affording care as well as caregivers having sustainable jobs. So they definitely are becoming more and more intertwined.
This makes me think a bit about just overall disparities. One thing that I've been grateful to have a seat at the table and a front row seat in conversations within our organization at AARP is just our focus recently on disparities, and not just disparities work as it relates to wealth gap issues and wealth gap conversations, but also on the health gap side as well as it relates to social determinants of health. And although all of us know that these aren't new issues, they've been issues that have been pervasive for many decades, for many, many years, it does make me think about when the tide started to shift and people started making the connection between health tech and FinTech. Marla and Sheila, do you all know when that happened, when people started blatantly talking about, okay, there is a connection here and we need to do something about it? Was it within the last 10 years, 20 years, 30 years? When do you think those conversations started to happen?
Yeah, I'll take a crack at it. And Sheila, I would love your thoughts on it as well. It's a really interesting question. And Sheila has a very interesting perspective on that, having been close to it for so long. For me, it feels in the financial services space, I've been involved in consumer credit for longer than 15 years now. And we knew and have known for a long time that that the drivers of financial distress are twofold, generally speaking. It is some kind of a shock, like loss of job. It is a personal life change, like a divorce or loss of a loved one, death in the family. And it is a medical shock, right? Someone gets ill. Those are the three drivers of primary risk in consumer finance by and large. And so whether that was explicitly then used to engage the healthcare sector, I think was a step further, but certainly as a discipline in the risk management space around credit risk, we've known this for at least 15 years, probably 20 years now, that is a big driver of risk in our portfolios. And we were looking at losses and predicting losses, which was one of the responsibilities I had in my executive career. That was absolutely a consideration.
Yeah, if I think about CARE and founding it about 14 years ago, at the beginning of that journey, I found that I had to actually use my voice to advocate a lot that care needs to be defined as an economic imperative, because often it was described as a personal, soft issue, certainly impacting the economy for the budget and overall that was sort of driving deficits and things like that. But it was still viewed as a personal decision and often described as a social service and an entitlement versus a driver of jobs, right? When you have great care, people can work, and that it can actually contribute to the growth of the overall economy. So that, I would say, even 14 years ago, was not the dialogue. I think it has since changed. I think care is being much more equated to an economic imperative. And I'm just thrilled to see that. And I think we need to describe it also not as a female issue and a gender issue, and instead it is an overall issue for the entire family, for employers, for our government, and it needs to start to change.
Can I just add one thing to that, Jacqueline? Because I do think Sheila is being a little bit too modest, right? And I want to emphasize the role that Sheila herself actually played in changing that narrative. And one of the ways that she was able to, at care.com, engage employers was by demonstrating that you are actually providing value to your employees when you bring care inside of your organization and reduce the number of days missed at work, improve productivity. That was all part of what Sheila was able to do with care.com. So Sheila, I'm going to give you the pat on the back that you are too modest to give yourself right now, and just recognize that you played a pivotal role in changing that narrative. So bravo for doing that.
Thanks, Marla.
Marla, you just brought up an interesting point that I wanted to just stick with for just a second. And you mentioned how organizations that are figuring out ways to connect the dots for their employees to really provide a more holistic support system as it relates to health and finance, that organizations and employees are better for it. I'm just curious, are there organizations that you know that are doing that right, that are holistically approaching that and creating a safe space and a holistic way to support their employees? Any that you know that are absolutely doing that right, Marla?
It's hard to call out any individual organizations, just don't have the breadth of knowledge to do that. But what I can say is I have started to observe that organizations think about their benefits now in a much more holistic fashion and think about them as a source of competitive advantage, and that they look for the package of whether that's healthcare as kind of the one of the baselines. And in this country, we've chosen to orient healthcare around employment, which I have my own point of view on, but that is one of the considerations. And then there's been this growing basket of additional pieces to be able to add, whether that's in some cases some interesting opportunities to add access to credit through your employer, and whether that, or if it's something like what we were just talking about, right? The ability to have emergency care for your elders and loved ones. so that even if your primary care falls through, you have a fallback and you have access to support that you need in order to be able to make that happen. And then there's the investment that the organizations have made in providing it and then ensuring that their employees actually use it, right? One of the big pieces on this is not just informing employees, but helping them understand how to make best use of it. And I've certainly seen investments in those areas as well. All of that to me points to a recognition of the importance of wellness and wholeness amongst employees, and I'm excited to see employers embrace that, and hopefully that'll continue to spread through the corporate and even small business sectors.
And Jacqueline, a place where I think I'm gonna just assume sort of, what I've been observing, especially where the future is going post-pandemic, I think that the corner office having visibility on work-life balance, on challenges of care, both healthcare as well as care for families, and the struggle to kind of make ends meet because, the Zoom world, you can't avoid but see it. You can see everything that's happening in the background. You can see the challenges that are happening, and then what's happened too, I think many of the corner office has also stayed home and they've seen the challenges of being at home and what women juggle. And so that proximity, I call it, in leadership is actually, I believe, going to change the dynamic in many organizations about where this is headed, to provide that support. There's already a wave, as Marla pointed out, but I think even more so, given how proximate the leaders are for the challenges that families face and their employees face.
And now that we are seeing the world transitioning to opening back up, lots of organizations now have perspectives and points of view about when employees are going back and what that support cycle looks like. I look forward to what's to come over the next 3 to 6 months. So we'll surely see. Sheila, I am super curious back on the innovator side of things and entrepreneur side of things for you. When you are thinking about innovators and entrepreneurs and starters who are specifically maybe in the FinTech or HealthTech spaces, what recommendations might you provide to them to help them position themselves better for both HealthTech and FinTech challenges as we all age? Like, how can they position themselves to really tackle both, regardless of if they're in HealthTech or in FinTech?
Well, one of the exciting things about Jacqueline for this finale, and I'm so excited that you all invited me in such an honor, as I think about helping startups. And one of the things I do now at NEA as a venture partner is I think about what are the important things to get funding to try and scale overall. We look at total addressable market. Absolutely, it's got to be big enough. Health and FinTech, clearly, you're in a space that's already big. We look at the concept, make sure that you've got a clear moat overall in your concept and idea, because it can be very competitive and challenging. So you got to make sure you double down on that. But I think the most emphasis I would give is team. And it's really an emphasis on the people that you surround yourself with as advisors overall. And why does it matter so much also in health and FinTech? Because as Marla points out, AI is going to play a much more important role. But at the core of what I believe is that any product or service, there are people behind it. And so do not underestimate the importance of your team, your advisors, your board. Marla has been a credit to me in my life, has been an incredible advisor and coach to me personally. And so it's surrounding yourself with people that can actually help you grow. I always say this to startups, do not underestimate that. You can double down on the concept and the mode and the technology, make sure it's differentiated. But especially when it comes to healthcare, you're in a people service, people-centric business. Improve the technology and the AI. Make it differentiated, but make sure that you clearly understand that your strategic force in all of this is how you actually scale with the right people at your side to help you grow.
You know what I appreciate about that perspective is we've had the opportunity to operate both on the FinTech side of the house and the HealthTech side of the house as a part of our relationship with MassChallenge. And what I'll say time and time again, going into the pitch sessions that MassChallenge orchestrates each and every year, is there's usually a huge emphasis when startups come in to do pitches on their team, right? And how important your team is, how all days aren't, the most happy and glorious days, but a team is what keeps you going. And so I do appreciate you highlighting that. Now we get the opportunity to roll into the wish list part of today's conversation. I love opening up popping the hood and opening up the curtains and really asking what are our industry experts and our subject matter experts and our panelists, what's in their big bag of wish lists. And so Marla, I want to start with you first. Thinking about the things that you'd love to see solved in the next few years in both the FinTech and HealthTech spaces, what might be on your wish list? And Marla, you can't say everything. That's the only caveat here. What's on your wish list?
All right, so you're not letting me off the hook with the easy answer. So I guess, Jacqueline, if I had to narrow it down, though, and actually articulate one thing that I would like to see, one change, and maybe I'll describe a category of change and what makes me really excited for the possibilities of what's to come, is to really capitalize on this opportunity that I think we have right now, coming out of a pandemic, dealing with and coping with racial reckoning in this country, is the opportunity to build a much more inclusive ecosystem. And one of the primary ways I can imagine that ecosystem changing is informed by what we know Sheila is just doing right now, right? And having Sheila here and seeing Sheila at NEA is so gratifying for me, because what I would hope is that this is the beginning of seeing much broadening out in much wider variety of perspectives and life experiences and backgrounds, writing checks, making decisions, and giving the green light and the go-ahead to more founders from a variety of backgrounds that will take a perspective on solving a problem that is informed by their own unique life experience. And that if we can broaden that out, there are things that I cannot even contemplate, that I don't even know are possible, that are resident in brains that are waiting for the opportunity to be just activated. And so what I'm really hoping is that we can see check writers of all backgrounds, from every walk of life, from LGBTQ to people of color, women, and broader categories of men, all across the board. That change would, to me, potentially unlock the kinds of innovation and creativity and change how we live going forward in both of these arenas. So that's, if you're going to make me pick one, that's what I would pick. I would love to see that. I'd love to see more Sheilas in the world.
Marla, you made reference to Sheila several times in your response, which means that you're probably excited about her response to the same question, and so am I. And so, Sheila, it's your time to dig into the bag of wishes. If you could literally dig into a bag and pull out what you'd love to see solved for in the FinTech and HealthTech spaces over the next few years, what might that be?
Jacqueline, my wish list is actually built on Marla. I always think to myself, growth without inclusion, is that really something that we should celebrate? That kind of growth? Is that really growth with either inequality or a sense of not embracing involvement? And so, we sit here as a venture partner and we look at deals. And I know at NEA, we very much value companies that are mission driven, that are purpose driven, and doing something in the world. And that is near and dear in my heart, right? And for care.com, and more entrepreneurs, females, males, doesn't matter, everybody, all skin colors, all different types of orientation, whatever where they're coming from. That meritocracy in this country is really what matters. I just share a very emotional moment when I'm at the New York Stock Exchange with my co-founders, which is a very diverse group, African-American, Indian-American, Filipino-American, and Irish-American man. And we all got together, and the pride that we had in that room, that you could feel the meritocracy in this country. That's what I wish for. I wish that feeling upon every entrepreneur to know you can do it. You can do it here in America, and you can help a lot of people.
It's only right. I always challenge myself to also answer the questions that I ask of those on panels that I moderate. And so I'll also answer this question for the audience as well. From a wish list standpoint, I only wish action. There are lots of different avenues that each and every one of us who's sitting in today's conversation sit in, whether it be an investor, whether it be an accelerator that you're a part of, and of course, if you're a startup, We all have learned lots of different perspectives of information from both Marla and Sheila today, and lots of things that we will learn throughout this entire program. And my ask and my wish is that we continuously take action, not just go to sessions and collect up good information and collect up good data just for the sake of doing it, but that we take action in our respective areas in the world to solve for many health tech and fintech challenges. So I want to take a second and say thank you to Marla, and also thank you to Sheila for joining me for today's conversation. For MassChallenge, thank you for convening such a dynamic opportunity to talk about the intersections of health tech and fintech. So Sheila and Marla, thank you for being here. And Chris, I'm going to turn it back over to you.
What an empowering conversation. Thank you so much to Marla, Sheila, and Jacqueline for sharing your experiences with all of us tuning in today. Oh man, so much learned today. Look, the power of creativity applied to innovation, applied to impact can mean a lot to a lot of different people. And also personalizing your journey, personalizing your entrepreneurial journey and your collaborative efforts. And also creating ecosystems from the governor's office through MassChallenge, through the women that we just heard from in this amazing panel. Look, this has been an incredible event. Congratulations to all of the startups, champions, and partners for what they've accomplished so far together. I know I'm not alone when I say that I can't wait to see what you accomplish in the near future of these industries. Applications for MassChallenge HealthTech and FinTech will open in early September, so startups, stay tuned. To get involved in MC as a partner or a mentor or a judge and a donor, and to help drive change in health and wealth, follow the link at the bottom of this webcast to learn more. Thank you again. My name is Chris Denson. It's been a pleasure being your host for this evening. And with that, I'll kick it over to our lovely CEO, Siobhan. Siobhan?
What an inspiring celebration. To close, I want to acknowledge the incredible health tech and fintech communities we have built over the past 5 years. Startups, partners, champions, experts, government officials, donors, investors, and so many more coming together to create significant impact and growth in a way that hasn't been done before. Thank you so much for being part of it.